It's my pleasure to welcome you all here for this announcement of a consequential partnership between Ochsner Lafayette General and the university. You know, institutions, whether universities or healthcare systems, have an obligation to listen to their communities, to anticipate what the residents need both now and in the future, and to answer those challenges when they arise. And it's no secret that this region, as Jamie said, like the nation itself, is facing a healthcare workforce challenge. Our health providers don't have enough nurses to offer help and healing. This shortage is critical and it's growing. Barriers to quality care affect health outcomes for us and for Ochsner that is simply unacceptable. Now, answering this challenge for the people of this region and throughout Louisiana is what today is about. So I'm pleased to announce that the university and its College of Nursing and Health Sciences has partnered with Ochsner Lafayette General to create an Accelerated Bachelor of Science in Nursing degree program. That's applause. This program will enable students who already hold a bachelor's degree in any field to earn a nursing degree in less time. A substantial investment by Ochsner is making this program possible, and I want to thank the executive team of Ochsner and for their partnership and for their shared vision in meeting this serious healthcare workforce shortage. Thank you all very much. Now, this Accelerated BSN program is good news on several fronts. It means more nurses in our hospitals providing high-quality, compassionate care. It means better health outcomes, and it means a healthier population and a healthier Louisiana. Today's announcement exemplifies and advances an ambitious and intentional vision that the university is pursuing for healthcare education in our region. This vision will be reflected in the opening of a new health sciences campus this fall, which will expand our ability to enroll and graduate more health sciences students, furthering our historic role in the education and growth of this region's healthcare workforce. It includes creating collaborations with professional schools and health systems, deepening our relationships with biomedical and biopharmaceutical firms, and as today shows, this vision includes enhancing collaborations with community partners like Ochsner, with whom we share a long and historic tie, and this will only grow stronger through initiatives such as this. Now, transformational futures are built on solid ground and through exceptional partnerships. Our College of Nursing and Health Sciences provides the first, and our partnership with Ochsner offers the second. And the university and this region are fortunate to have both. So thank you again to our friends at Ochsner and to all of you for joining us here for this exciting day. Go Cajuns.
The spirit of togetherness and cooperation and really helping one's neighbors in times of need better than South Louisiana and Acadiana. And this partnership between the university and Ochsner Lafayette General to meet the challenges facing our healthcare sector is all the proof you really need of that. I think this exciting news actually deserves another round of applause.
The worst pandemic in a century was a stark reminder of how critical nurses are for our hospitals, for our patients' health, and for the well-being of our community. You see, bedside nurses are the heart and soul of healthcare. As a pulmonary critical care physician, I can speak from experience that only a team-based approach with nurses at the center playing the critical integral part is the only way to provide excellent health care. During the pandemic, nurses put their own health at risk to care for others. They comforted dying patients at the bedside when their family couldn't be there with them so they wouldn't die alone. They helped educate and vaccinate our communities when we needed them most. Nurses are our heroes. But the pandemic has taken a personal toll on them. And we've seen many leave the workforce. And this has exacerbated an already critical shortage of nurses throughout the United States. Our nursing shortage impacts us right here in Lafayette because it impairs our access to get the care that we need and our families need. The Ochsner-UL Lafayette partnership is a critical part of the solution. Together, we are already training master's-prepared nurses to be future educators, and we're providing more clinical sites to train more nurses for the UL Lafayette growing expansion of their nursing school. Now, this new accelerated program will give more people career options and train more nurses for our communities. This means we can see new nurses as short as 15 to 18 months at the bedside caring for us. Partnerships like this are a critical component of Ochsner's collaborative Healthy State initiative, which is making Louisiana a better place for us to prosper and live healthy lives. In 2020, Ochsner launched the Healthy State to be a catalyst and a convener of bringing stakeholders together to improve Louisiana's national health rankings by the year 2030. In the last year, public and private partnerships in multiple businesses and sectors throughout Louisiana have gathered to form a Healthy State Advisory Board. Jim Henderson from the University of Louisiana Health System is one of those critical members, and I want to thank Jim Henderson for his service on that. Together, we aim to solve the key drivers of poor health, the life circumstances that make health care and wellness so difficult to access for so many. These circumstances include unemployment and poverty. Through partnerships like this one, with UL Lafayette, we're bringing more living wage jobs to Louisiana, and we're also solving for our health care workforce crisis. It's going to take all of us to improve the health and wellness of our communities. We're so grateful for UL Lafayette for their partnership in helping leverage the human capital of our state, and we can't wait to see what future brings for this partnership.
There, and good morning to everyone. There has never been a better time to be a nurse, and this partnership represents the perfect opportunity to enter into the most trusted profession for the past 21 years. According to a recent report by Johnson & Johnson, jobs for registered nurses will increase by 15% by 2026. When this is taken into account, along with the current crisis in the RN workforce, academic practice partnerships such as this one are critical to meeting the needs of all, particularly our aging population and those living with chronic conditions. This innovative program is the only one of its kind in the Acadiana region. And as Dr. Savoy said, it's geared to those who have earned a bachelor's degree in any area and are interested in embarking on a career in nursing. Upon successful completion of general education courses, these students will have the opportunity to complete required nursing courses in 15 months. This investment by Ochsner Lafayette General will support student success by providing tuition, but also providing faculty and clinical sites, which have historically presented significant barriers to program expansion. In exchange, graduates of the program will bring their professionalism and compassion to Ochsner Lafayette General and its patients for at least 3 years. All clinical experiences will be completed in one of the local Ochsner healthcare facilities, and students will receive an excellent education, which will include the full spectrum of nursing care delivery systems and settings. Graduates of the program will hold a Bachelor of Science in Nursing degree from our highly reputable program. Upon successful passage of the NCLEX RN licensure exam, these registered nurses will be very prepared to assume a position at Ochsner Lafayette General. They will also have the prerequisite degree and educational experience needed to pursue advanced nursing education if that's what they plan to do. By providing support for faculty and students and ensuring access to clinical sites, the Acadiana nursing workforce will be strengthened and will be better able to meet the needs of the community. Transfer credit from their first degree program will be accepted and applied to the degree requirements of the BSN, and academic support, due to the generosity of Ochsner, will be provided throughout their educational experience to ensure that these students are successful. Graduates of the program will represent Ochsner Lafayette General as proud members of the College of Nursing and Health Sciences alumni community and continue in the Ragin' Cajun tradition of providing the best nursing care to patients and their families. Thank you. Thank you to our partners at Ochsner and to all of you for joining us today.
Our final speaker this morning is Mr. Patrick Gandy, Jr. He's the Chief Executive Officer of Ochsner Lafayette General, representing the Acadiana region of Ochsner Health. Under his guidance, Ochsner Lafayette General has become a leading healthcare provider, serving nearly 250,000 patients per year. With 5,500 employees, 8 hospitals, and over 800 clinics, Ochsner Lafayette General is leading the way in health care for Southwest Louisiana. As CEO, Mr. Gandy has brought his extensive experience, strategic thinking, and dedication to innovation to the forefront, driving growth and progress for the organization. A proud UL Lafayette alum, he holds an MBA with an emphasis in healthcare administration. Please join me in welcoming Mr. Patrick Gandy.
Thank you, Dr. Savoy and Dr. Hebert, Dr. Broussard. Leo's here every step of the way. It's been a long time coming, so we're super excited about this. So I'm honored to be here today to announce the launch of and the celebration of the UL Lafayette Ochsner Accelerated Nursing Program. This collaboration that's been a long time in the making and one that just simply makes so much sense, not only for our organization and the university, but most importantly for our community. And I'm thankful to everyone in this room who said yes, so thank you. And all of you had a hand in making this possible. UL Lafayette has a highly ranked nursing program, and it is literally in our backyard. So it was really easy to come over here for all of our meetings. It's like 2 blocks away. But more importantly, the nurses that have come out of this program have been taking care of our patients at Ochsner Lafayette General for decades. And in fact, the excellent care that our patients have come to expect at all of our facilities and come to rely on is largely attributed to the nurses that have graduated from this program. We have a long history together with UL, and today we're taking that to the next step in this expansion of our partnership. Together, we will increase the nursing capacity at UL Lafayette. We'll educate and prepare more nursing professionals for Ochsner Lafayette General and serve and heal our communities well into the future. In a word, this partnership is exciting, and all of us should be very excited about what we're announcing today. This is a huge step in building what we need to be prepared for the future, building the staff that we need that will allow us to continue to meet our mission. This is how we're going to be able to continue to put patients first and continue to be the provider of choice in Acadiana. As you know, Acadiana has not been exempt from the nursing shortage that's a national and worldwide shortage. And this program will play a crucial role in allowing us to address this problem. We have essentially taken the matters into our own hands. In Acadiana, we recognize nobody's going to solve our problems for us. We've got to solve them ourselves. And that's what we're doing here, working collaboratively with the university. We recognize the urgency of the nursing shortage and the vital role that nurses play in providing high-quality care to our patients. Through this partnership, we aim to create a pathway for aspiring nurses to enter the profession quickly and with the necessary skills to succeed, giving graduates the opportunity to make a real difference in the lives of our patients, to make a real difference in their families' lives. And because, simply that's what nurses do. Nurses make a difference every single day. At Ochsner Lafayette General, we are committed to investing in the future of healthcare. By partnering with UL Lafayette, we are creating a pipeline of highly skilled nurses who will be at the forefront of innovation and progress and at the bedside providing safe, effective and compassionate care, and we're going to be able to do that sooner than we ever thought was possible. Ochsner Lafayette General and the University of Louisiana Lafayette have been anchors in this community for more than a century. Now, our names have changed during that time, but our commitment to our region and to all the communities that we serve has not changed. So I want to emphasize this, that strong communities create strong partnerships. When you leverage the strengths of two robust organizations like ours, it allows us to come together, allows us to collaborate, it allows us to work towards a common goal, and it leads to achieving more than that could be done individually. And ultimately, our goal is to create a more resilient community. By having these types of partnerships, by making these types of investments, we're doing just that, creating a stronger, more resilient Lafayette and a stronger, more resilient Acadiana. So thank you again to everybody who got to yes. We're excited to be here and look forward to the future.
I want to thank everyone once again for being here today to celebrate this momentous occasion. It's been a long time coming. We visited about 3 years ago in my office for the first time to start talking about these ideas. But, you know, doing things the right way sometimes takes a little longer than doing them in an expeditious way. And this is about doing things the right way. It's the way that Ochsner Health does things. It's the way the University of Louisiana Lafayette does things. And so we're all very, very proud to be a part of this occasion today and this announcement.